Around 66,000 people in Michigan learned they have cancer this year. That's according to American Cancer Society. Early detection remains the top factor in achieving a good outcome. Dr. David Rzutko, Vice President of Medical and Clinical Operations at Priority Health, is here just before Cancer Screen Week kicks off. Thank you so much for being here with us, Dr. Rzutko.
My pleasure. Thanks for having me.
First, just talk about what are you seeing when it comes to cancer cases here in West Michigan?
We're definitely seeing earlier diagnoses, and we're seeing a prevalence of lung carcinoma, colon carcinoma, men's cancers, seminoma and testicular cancer, pancreatic malignancy, so kind of a smattering of a number of different cancers.
We know early detection is key, right? Expand more on how we can improve cancer outcomes.
Yeah, so when we're diagnosing folks later stages, it becomes much more difficult to treat and get a good outcome. In the instances where we are diagnosing and managing earlier, we can actually take some malignancies that in latter stages do have a significant and high risk of fatality and mortality. But if we're diagnosing those earlier, we can impact a good outcome.
So what types of cancer screening should people be most aware of, and at what age should they start?
Yeah, it's going to vary by the type of malignancy that we're trying to address. And so we'd really say be speaking with your physician or your doctor, your provider, when you are doing your annual exams. And then, you know, men and women are going to have different malignancies that we're diagnosing and treating or screening for. Some of them are going to be just general in-office screening. So like for men's health, testicular cancer is an in-office exam. For women, we're thinking about breast exams that we'd be doing in the office. Sometimes there's imaging associated with some of the malignancies. So for breast cancer, it would be a mammogram or other interventions or other types of screens. Colon cancer is a colonoscopy. The United States Preventative Services Task Force, or the USPSTF, has actually changed the recommendation for when we should start screening for colon cancer, reduced the age from 50 down to 45. So many more folks are eligible for that screen. And so it's going to vary based on age and your own personal risk.
Yeah, and family history plays a role as well.
Family history, exactly. And so, for example, if mom or dad had primary colon cancer in their 30s, even though the USPSTF says for an average risk person, it would be starting to screen at age 45, well, the evidence would show that we should start screening siblings and younger folks or offspring at even an earlier age based on your own individual risk. That's why it's so critically important to be talking with your doctor about what would be appropriate for you.
Dr. Rzutko, what do you say to the person maybe watching right now who says, you know, I'm healthy, I feel good, I don't need to get screened? Yeah,
and that's actually the reason why, because as I mentioned, this whole notion of stage shifting, that the later that we're diagnosing a condition, or oftentimes after it's symptomatic, our ability to improve or to get a good outcome is definitely impaired. And so primary screening, when we're asymptomatic, if we can catch things in early stages, stage 1 or stage 2, or before things have had an opportunity to grow or metastasize, we can get a much better outcome.
Okay, so if someone says, okay, I want to get screened, where can they go? What are the resources out there that would help them to get started?
Yeah, so on our website at Priority Health, you can find a whole host of resources about primary prevention, primary screening, and then certain disease states. So you can reach us on the back of your insurance card or at our 1-800 number. The American Cancer Society has a plethora of information as well, and certainly your primary physician or your doctor.
Okay, Dr. Rzutko, is there anything else that you wanted to share?
Yeah, I think this is one of those things where primary prevention, an ounce of prevention, is definitely worth it in the long run. And there are folks that might be a little reticent to go to a physician or go to a doctor because they're worried about what they might find. This is one of those times where we really say doing some preventative care up front can really impact a good outcome long term. So don't be afraid to go to your doctor.
Yeah. All right, Dr. Rzutko, thank you so much for being here with us. Appreciate it.
My pleasure.
Scott.